Thank you so much, everybody, for tuning in today. My name is Dr. Tiffany Crank. I serve as the Director of Health Equity and Community Impact in the Office of Health Equity here at the ADA. And I have the distinct honor of having a conversation with one of our wonderful community partners out in Charlotte, North Carolina, Reverend Sandra with the Heights Ministries today. And so to get us started, Reverend Sandra, if you would just introduce yourself to everyone and tell us a little bit about you and the Heights Ministries. And then we have just some really good conversation we're going to get into today about health equity and the work that you guys do in the community.
Okay, well, thank you for inviting me. My name is Reverend Sandra Grace Springs. I'm with the Heights Ministries. I'm the executive pastor and the executive director of the Heights CDC. To tell you more about the Heights Ministries, I believe that will all come with our conversation. So I won't prolong that. I'll wait until we get to that, okay?
Keep us on the edge of our seats.
Yes, ma'am.
That's right. That's right. Well, thank you so much for joining today for this conversation. The first thing I want to ask you is, what does health equity mean to you and your organization, and why is it so important to what you do?
Okay. Well, the answer to that question actually lies in the why we do what we do. We believe that all people in urban areas deserve access to equitable health care and healthy food choices. But us, that means not just investing in the streets and the buildings as they have done in our community, but also investing in the spiritual and physical revitalization of the people who reside in our community. And because we have been in this community for decades, we know the disparities and the health inequalities that they suffer from. So we're committed to providing holistic generational health. That's what we do. It's vitally important because it means sustainable, healthy options. We want to keep it going. We don't want to just start something and drop the ball. That means we want to sustain it throughout generations.
Yeah. Yeah, and you mentioned health disparities, and I'd love to get into that a little bit. And can you talk a little bit about how health inequities disproportionately affect certain groups in your community?
Well, within our community, we've noticed that certain groups are susceptible to the disparities associated with social determinants of health. Now, that includes unhealthy food choices, pre-existing health conditions, and inherited health conditions.
Mm-hmm.
And we all know social determinants of health are classified as the conditions in the environment where we live, where we worship, where we play, where we work, and where we age. So these social determinants affect a wide range of health inequalities in the community that we serve. It causes risk and poor outcomes for their health. Now, if you want me to elaborate, I would like to on that. What we
Please.
actually noticed firsthand is that high poverty rates and economic disparities compared to the wealthy parts of Charlotte is associated with the health disparities in our community.
Mm-hmm.
Inadequate transportation options where it's problematic for low income residents because they have to rely on public transportation to get to work or to get to the medical facilities. Limited healthcare options within our corridor, 28216, the Northwest corridor of Charlotte. They pose a challenge for our residents because they don't have reliable transportation often. Greater health challenges, including higher rates of chronic illness such as diabetes, hypertension, obesity, and others, are partly related to limited access to nutritional foods. And that is one of the spotlights of what we do. We believe certain parts of our community, especially in the more economically disadvantaged areas, they're
Mm-hmm.
classified as food deserts.
Yeah.
So you have unhealthy food choices, which in overall impacts every chronic disease and every inequality in health that we see. So we see that as, the main point of what we do. And that's where we come in. We address these challenges through our coordinated efforts with local government, with community organizations, such as American Diabetes Associations, and even with the residents. They engage and they help us determine what it is that we need in the community to give them more healthy options in food and in healthcare resources.
Yeah. And I love that. I love how connected you are
Yes.
to the pulse of the community. And so you bring up you bring up chronic disease. And, when we think about chronic diseases such as diabetes or heart disease or cancer or stroke, um, to you, how do we continue to make sure people have access to knowledge and to the support that they need in the way of education on these things?
That's a good question. Because we do focus on holistic health, mind, body, soul, and spirit, pointing back to the spiritual identity of our holistic being, we know that people perish for lack of knowledge. So, how can they obtain knowledge if no one provides it to them? And that's also where we come in. It's imperative that there be screenings and trainings and healthcare assistance and preventive health education and hubs, as we are, hubs in each community for continued resources and information to be dispersed. So we offer events that initiate and educate the community on individual levels with short term effects. And then in addition to that, we look at sustaining positive uh, behaviors, lifestyle changes in the community. So that's how we look at the training. We address um, uh, the 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 lack of knowledge through whatever venue is available for them to gain it, whether it be via virtual, in person, if we have to go to them through flyers, however we do it, we have to do what we have to do to get knowledge out about the disparities that we face in our community.
Yeah. Yeah. And you have done such an awesome job kind of setting the stage of the need that is present in the community you serve. So now give us a peek behind the curtain and tell us about the Heights Ministries, and about your involvement with the Collaboration for Equitable Health, to date.
Well, our involvement with collaboration for equitable health uh, came even after we were already doing this for years, but and we address preventive health care. We have a food pantry. We have community garden. We have things to help them get the resources they need to address the disparities in the community. The Heights focuses on equitable health through collaboration with mental health agencies, chronic disease prevention, food scarcity, tobacco cessation, all of that. However, a new program was introduced to us in 2023 known as Project Power, and it was revolutionary. This program changed the lives of over 25 individuals, as well as their families and friends. The best way to promote, to uh, to let people gain the knowledge is by word of mouth. And so we began participating in that. And personally, as a participant in a program myself, offered by the American Diabetes Association, I first learned that I suffered from one of these health disparities. Along with this class, I gained knowledge and I gained tools and lifestyle changes to bring my A1C back into check. So I can share firsthand with individuals that this works, that knowledge works, that tools work. Fast forward to today, as a result of our collaboration with Project Power, we procured funding from Collaboration for Equitable Health that allows us to maintain and sustain our efforts to bring awareness, support, resources, and education in the community we serve. We partner with Mecklenburg County with Master Gardener Reginald Singleton, who does workshops, teaches us how to grow healthy produce. We also disperse that produce in the community. We have a summer feeding program that collaborates with our summer camp because, as we know, many children in our community do not get a healthy meal until they're in school. So we wanted to fill that gap. And by the grace of God, we've done that. We offer so many other classes. We offer a faith-based nurse that came in every week during summer camp to educate the children on health. We had fitness classes for the children. It's so much I can tell you, but we don't have enough time for it. But you can find out more if you reach out to us.
Yeah, absolutely. I wanted to ask, what have you been able to achieve? And that is a really robust list of things that you've been able to achieve. So anything else you've been able to achieve, or any hopes for the future that you want to share that you have through the program?
Yes, I believe our greatest hope, because funding in certain areas is so scarce,
Mhm.
is to become financially solvent so that we can sustain what we do.
Yeah.
So that when needs and gaps arise, we rise to the occasion. We want to promote generational health and wellness, not just for those now, but for generations to come. And lastly, our hope is to sustain what we do effectively and efficiently so that we can become the blueprint or the roadmap to equitable health and food insecurity in our community.
I love that. I love that.
Okay.
Okay, Reverend Sandra, this has been so good. The last question I have for you is just for you to leave with everyone. Where can people go? How can they learn more about the work through the collaboration for Equitable Health, and even join efforts?
Okay. Well, we do have a Facebook page, the Heights Ministries, the Heights Ministries, and there you'll find a lot of the work that we do. To
Mhm.
be more poignant to what we do, we have a website. The Heights Ministries and the Heights CDC work hand in hand. So at the heightscdc.org, the Heights with an S, CDC.org is where you can go to see exactly what we do. Last but not least, you can always reach out to me at 704-621-8443. I'm always available to talk to anybody about what we do, what we hope to do. Okay?
Awesome. Awesome. And for anybody else that wants to learn more about the Collaboration for Equitable Health, you can always go to collaborationforequitablehealth.org. Thank you so much,
You're so
Reverend
welcome.
Sandra, for joining us today for this live session. Personally, I am just over the moon to have the privilege of working with you in the
Thank
community and
you. Thank
alongside you in the community every day. The Heights Ministry is an amazing organization doing amazing things.